angry with you over time. From holding your head up, from, you know, ear on the phone while you're on the computer trying to talk to somebody, or trying to write, you know, whatever it is. And the massage therapist side of me knows that that's typically a very tender muscle in most people because it's not someplace that really ever gets touched a whole lot. Let's see. Thyrohyoid muscle, it's in front of the thyroid. It comes up into the bottom of the mouth, down to the hyoid bone. The hyoid bone, I'm not going to take his skull off, but the hyoid bone is a tiny little bone. It's like on, kind of floats. It's attached with ligaments and muscles. Doesn't really have a true joint, but it's a connecting point up in your throat. Omohyoid, again, it's a muscle that goes to the base of the throat and into the hyoid. Sternohyoid, so it goes from the sternum to the hyoid. Okay. All right, so let's move into the thoracic spine. So we've been saying all morning that the thoracic spine has less motion than the cervical and lumbar regions because of rib attachments, because of the shape of the vertebral bodies. We talked about that, and because of the length of the spinous processes. Okay, so they're just shaped to pretty much stay in place so that we can protect our heart and our lungs. Okay, moving on down is the lumbar spine. The lumbar spine is the region of the body that's most often injured. The reason for that is it absorbs the majority of our body weight and any weight we carry. Okay, so if you think about it, when you walk or run, that jarring comes up and hits you at your low back, as you're carrying whatever weight is from your waist up. Okay, so your body weight is one thing, and then if you're carrying a load, whether it's a backpack, whether it's a baby, whether it's a box of widgets, you know, whether it's your patients when you're doing transfers. That's why body mechanics doing your transfers, body mechanics doing your manual muscle testing and motion measurement is critical, because yes, this is the most often injured part of the body, but the reason for that is usually not the one-time thing. It's a lifetime of doing it wrong, and that one thing is the straw that broke the camel's back. Okay. We're going to be reminded that our center of gravity is about 2 inches anterior to S2. And most of the movement of the lumbar spine occurs between L4, L5, and L5, S1. So that's where you see the most of the disc herniations is down low. So here and here. Okay, but I can tell you, once you have a herniation or a problem here, it kind of just, over time, creeps right up your spine. I've got a friend who's on her probably about 3rd lumbar surgery. Wow. It started here, started from an injury, actually. She's a pediatric therapist, and she started from an injury when she was taking care of a kid. It was just one of those weird things. One of the problems with moving people